Today we have Dr. Izabella Wentz, who's a pharmacist, who has really dedicated her life to working with people with Hashimoto's. She herself was diagnosed with Hashimoto's in 2009, and she is the author of the New York Times bestselling Hashimoto's Thyroiditis, Lifestyle Interventions for Finding and Treating the Root Cause. Welcome, Izabella. How are you?
Hi, Amy. It's so great to be here. Thank you so much for having me.
Well, hey, let's jump right into it. So I know you got into this because of your own experience with Hashimoto's. So do you mind sharing, with the listeners a little bit about your story and how you got diagnosed and involved?
Yeah, of course. And so in full disclosure, I was never super interested in the thyroid during pharmacy school. And it's actually probably too bad because I was having a lot of thyroid symptoms that probably started in my undergraduate studies and then continued on during pharmacy school. So I had been a bright-eyed and bushy-tailed kid and high school student. And all of a sudden, after a bout with Epstein-Barr Virus, I just became really, really exhausted. So I found myself sleeping from 12 to 14 hours each night, having horrible brain fog, having anxiety, and just not feeling like myself anymore. I was told by my university clinic that I had Epstein-Barr virus and that it would pass, but I was still tired all the time. And then I went from being a person that would sleep for 6 to 8 hours and felt really energetic to a person that would sleep for 12, 13, 14 hours just to get my rest. And eventually I began to compensate. So during pharmacy school, I had the craziest schedule where I would basically sleep in between classes just to get my things done. And eventually I just learned to live with it. And I would go to different doctors and I would ask about my symptoms, and I was offered Provigil or antidepressants or stimulant medications because I was always so tired, but nobody ever said there was anything wrong with my thyroid. So this kept going on. And finally, when I graduated from pharmacy school and I began to work in the real world, I realized that not all physicians were created equally. And so I sought the advice of a more integrative physician that was willing to do some more advanced testing on me. And at that point, I learned that I had Hashimoto's. And the really big push to get diagnosed for me was that I started to have more and more symptoms. So it wasn't just fatigue anymore. So it was hair loss. It was horrible brain fog where I would go into meetings and take notes for an hour during a meeting, and then I'd walk out of the meeting completely forgetting what I took notes about. I had carpal tunnel in both arms, irritable bowel syndrome, acid reflux, and all of these, seemingly benign things. Nobody thought to hospitalize me, but at the same time, they were very, very uncomfortable, and I was still in my 20s. At that
also really a whole host of symptoms that a lot of doctors could have said were unrelated, right? You might have, I don't know if you had experience of going to a lot of different doctors and perhaps getting a lot of different medications for all your different symptoms, but nobody, really putting it all together for you.
Exactly. So I went to a gastroenterologist for my acid reflux, and then I went to an allergist because I was all of a sudden sensitive to everything. I went to a primary care doctor, and I was going to all these different doctors because different systems were falling apart. So I had carpal tunnel in both arms, and I was constantly tired. And finally, when I was diagnosed with Hashimoto's, I was actually relieved because I thought, finally, there's a name to this thing. Maybe I can take medications and start feeling better. And maybe I can overcome this. But then once I learned that this was an autoimmune condition, I sort of became confused because I was like, okay, so I have this thing, this autoimmune issue. It's attacking my thyroid gland, and my thyroid's being destroyed. And then I'm not able to make any more thyroid hormone on my own. So the solution is just to take thyroid hormone. And I'm like, okay, great. I get that. I learned about it in school. But what about the immune imbalance? Shouldn't I do something about that? And then, of course, the endocrinologists were saying there was nothing you can really do. And I was always a believer in cause and effect. And even in pharmacy school, though my primary focus was on medication optimization, we also learned about lifestyle to try to address different conditions to help prevent having the need on a medication or even helping a person taper off of a medication at some point. But there was nothing like that for autoimmune disease or thyroid disease. So at that point, I wanted to figure out what I can do as a patient to empower myself. And I had been working with some really rare kind of cases with people who had a lot of disabilities and a lot of rare disorders. So there was not like a standard of care for them. like there was for hypertension or diabetes. And so I was often looking at PubMed or looking at the patient experience or parents' stories to see how different patients with the condition found ways to address their symptom or address their lifestyle to feel better. And so I decided to kind of use the same methodology that we were using for the clients we served in a consulting capacity to do that for myself with Hashimoto's. And that's kind of how I became a Hashimoto's expert / human guinea pig, to really trying to get myself well.
Wow, that's a great story. Well, you're going to be the perfect person to talk about how infections, really play a role in Hashimoto's and thyroid dysfunction and autoimmunity in general. So you are, kind of something that I hear a lot from my own patients of, somebody who had Epstein-Barr and then their life was kind of never the same. I mean, I kind of put people with Epstein-Barr. I myself have had it. I felt like it definitely has probably, I'm sure, contributed to my autoimmunity as well. However, I felt like I kind of had that and got over it. So I find like there are usually kind of two categories of people with Epstein-Barr. There's people who kind of have it, wasn't great, but get over it and move on with their life. That was me. And probably some years down the line, it had an impact for me. But it wasn't the, primary trigger. Whereas it sounds like for you, that was potentially your primary trigger for your Hashimoto's, is having this infection. So I know that you have a great book and you talk about a lot of different factors kind of getting down to the root cause. And if we have time, we'll get into all of those. But the main topic I really wanted to talk about today, I talk about it as well in my book, The Autoimmune Solution, and in the Thyroid Connection, is about infections and how these infections really can set the stage and be the kind of tipping point for people. So I don't know if maybe we want to start with Epstein-Barr since that's kind of relevant to what you were just saying, and then move into some others.
Sure. Should we talk about molecular mimicry and all the different theories?
Yeah, absolutely. Yeah, you can start talking about how the possible mechanisms of how an infection creates an immune imbalance and autoimmunity, and then we can get into the specifics about the different infections.
Great. Yeah, I think just for context, for autoimmunity and the way that infections can play a role is there's a few different mechanisms behind that. One of them is the molecular mimicry theory, where basically something on the infection, so whether it's a bacteria or virus, there's a protein that looks similar to the infection as there is on the thyroid gland. So as the immune system starts to attack the infection, it also attacks the thyroid gland. So that's one way. The other way is the bystander effect. So this is basically where our immune system tries to destroy the home of the infection. And sometimes if the infection is hidden in an organ like a thyroid gland, the immune system may attack the thyroid gland. And then the third way that I believe infections can contribute to Hashimoto's is if they cause intestinal permeability or inflammation somewhere in the body. We know that inflammation and intestinal permeability are oftentimes a really big deal in autoimmune disease. So a lot of times this may be a gut infection that may lead to that. And so
there's one more with the hijacker as well, the hijacker theory with things like Epstein-Barr and herpes that get into our system and stay there long term. They get into the cell and kind of hide and turns the immune system on that way as well.
Yeah, absolutely. And so infections, they essentially have a way that they can trick our immune system and modulate our immune system. So rather than our immune system attacking the infections, the immune system will try to attack healthy cells, and it'll sort of let the infections kind of do their own thing. They're really nasty like that. The Epstein-Barr virus in particular has been connected to a lot of different autoimmune conditions, and definitely to autoimmune thyroid disease. 2015 Polish study found Epstein-Barr virus in 80% of the thyroid glands of people with Hashimoto's, and about another 60% of people with Graves' disease had the virus in their cells. They compared that to people without thyroid disease, and they found that very few people without thyroid disease actually had the presence of the virus in their thyroid glands. So one of the things—
That's pretty staggering, seeing as how, by the age of, I think it's 18 or 20 something, that, virtually 90 something percent of the population has been exposed to Epstein-Barr. So it's one of those viruses, as you know, you can either have, like you did and I did, a really terrible reaction to it, and it's pretty obvious that you're sick. But some people actually have it and don't even realize that they ever had it. In fact, many of my patients will tell me, oh, no, I've never had mono. And then we go and check their viral titers, and sure enough, they've definitely had it before.
Mm-hmm. Exactly. And one of the key things that researchers seem to believe is that the timing of the infection. So if you're a young child under the age of 10, when you get the infection, you seem to do better with it than if you're, let's say, a young adult, like a high school student, college student, or in your 20s or 30s. And so our immune systems, to a certain point, are able to suppress the virus. For some people, they may have a deficiency in the cells that suppress the virus. This deficiency can be genetic, and we also have we kind of lose those cells as we get older. So that may be one of the reasons. So we do know that about 90% of people have this virus in their system. So it's not necessarily the virus that's the issue, it's how our body handles the virus or how our body doesn't handle the virus. So the key is to figure out if the virus is a trigger for you. One of the things that you can do is do a health timeline. And if you had an incidence of mono or glandular fever, as they call it in the UK, and after that time you never quite felt the same, that may be an indication that Epstein-Barr virus may be a really significant issue for you. But like you said, not everybody has this obvious type of illness right after they get the virus. So for some people, they may need to work with a functional medicine practitioner and get some advanced testing to see if the virus has been reactivated. Whenever the virus reactivates, that's when it's going to be especially problematic for most people.
Yeah, and just for the listeners out there, I mean, yes, it's the functional medicine practitioners that typically believe in this reactivation, and many conventional doctors don't, but that is a test that can be done by any conventional doctor. You know, it's not a test that requires, specialized lab testing. These are viral titers that can be done by any lab in the United States. And then it is very questionable as to what really denotes whether it's a reactivation of the virus or not. It's very hard to discern. Some people say if more than a couple of the antibodies are elevated. Other people say, well, if it's these antibodies, but it's at this level. It's very controversial. But so it's something that I check, but I don't like hang my hat on it. I also see people get better without their viral titers really changing at all. So it seems to be, and with other physicians that I've talked to that are really measuring these and tracking them on people, it doesn't, we all can agree, it's in the literature, it plays a role, but the viral titer itself, I just urge people to not get so hung up on it. I mean, it's a piece of the puzzle, it's good to get it checked, but don't get so hung up on it because it's really hard to have those viral titers change, at least in my experience, yet people get better. So, what are some, I was going to ask you, what are some things that you recommend in your book or, through your counseling for people to try to overcome Epstein-Barr?
So one of the things that people can do is we know that the cells, the CD8 plus cells that help fight the virus, they're going to be vitamin D dependent. So we want to make sure that our vitamin D intake is sufficient. The latest kind of recommendations will say you should have your vitamin D levels between 60 to 80. That might change tomorrow. That's typically where I like to see my clients, and the ones that go into remission usually have their vitamin D levels that are somewhere above 50. So that's going to be one thing that's going to be really helpful. Supporting the adrenals, giving yourself plenty of rest is another really great strategy. Doing adrenal adaptogens can be very, very helpful. There's also some natural supportive remedies that you can do, such as monolaurin. There's different other types of herbs. Silver psyllin by Designs for Health can be helpful for some people with Epstein-Barr virus to try to get suppress the virus and prevent it from replicating. There's also some medications that people have found helpful, some of the antiviral medications. And of course, they would have to work with a practitioner for more of the advanced herbs and medications as well, because we can get ourselves in trouble if we just kind of do those willy-nilly.
Yeah. I don't use, for Epstein-Barr in particular, I don't use the viral medications too much for a lot of, they're meant for the herpes virus and some of the other viruses. So I, like you, go to the, more natural treatments first. And then, of course, the other things that we both discuss in our books, fixing the gut, getting off the foods that they're sensitive to. It's really, for a lot of people when it comes to these viruses, I find that it's, just really, as we both talk about, it's kind of the cup overflows, right? And it's the drops in the cup. And if you get rid of some of the other drops, that maybe then you can handle that Epstein-Barr virus, because that's really a tricky one as opposed to some of the other ones that we're going to talk about that really do have a very solid treatment for them. I find Epstein-Barr, these viruses, herpes, that hide in the cell, they can be very difficult to get. I mean, that's how they survive so well in our cells.
Mm-hmm. Yeah, absolutely. And so I definitely would say we started off with one of the more challenging infections, the Epstein-Barr virus. It's a little bit harder to control with just a straight up simple protocol. But when you're doing the whole body approach, when you're really taking care of your adrenals, making sure you're properly nourished, you're going to be helping yourself suppress the virus in that way. And of course, there's other types of herbs. I like lomatium. I like licorice for people with suppressing Epstein-Barr virus. And another thing that I've found pretty commonly in people with Hashimoto's, the Epstein-Barr virus, that just don't seem to get better is oftentimes they'll have gut infections. So one of the more common gut infections in Hashimoto's is Blastocystis hominis. It's a protozoan parasite, so it's not going to be something that you're going to see with your naked eye. So it's not a giant worm or anything like that. It's very, very tiny, and it's microscopic. And this is something that's been recognized as commensal by some researchers, which means that they think it's fine, it's supposed to be there, it doesn't cause any harm. Yet other researchers have been able to connect it with chronic hives, with irritable bowel syndrome. And I was excited to finally see one case report of this parasite being connected to Hashimoto's. And so what's interesting is there's a connection between arginine and Epstein-Barr virus as well as Blastocystis hominis. So one can actually deplete us of arginine, which then makes it more of a favorable environment for the other one to grow. And a lot of times I'll see when these two infections are present together, then the person has a harder time overcoming both. So a lot of times for people with the Epstein-Barr virus, when you address the Blastocystis hominis, or we'll just call it blasto because it's such a word, they actually start feeling better on all accounts. So they get their energy back, their food sensitivities diminish, a lot of their gut symptoms quiet down, and then they're no longer having a lot of the symptoms that are associated with thyroid issues. So some case reports have, I have seen some people go into remission from Hashimoto's after treating that. The case report that was in a medical journal in 2015 did report one person getting into remission. Typically, I'll see thyroid antibodies greatly reduce and symptoms greatly reduce after getting rid of the blastoparasite.
Yeah, if you go to the CDC website, it will tell you that you don't need to treat blastocystis. And I see this routinely in my clinic. I mean, it's not as high as Candida and SIBO, but it is up there as one of the far more common infections that I see on at least one of the comprehensive stool analyses that we do in my clinic. And I treat everybody for this infection and definitely see, amazing results. So I agree with you and the literature out there. Certainly if this is something, and just for the people listening, and this would be something that you would want to get through a functional medicine or integrative practitioner through a very comprehensive stool test. This is not something that would typically be picked up on your regular stool test, a culture and sensitivity through your regular doctor. And how about treatment for that?
So there's a few ways to treat it. One of the things that I really like to do is recommend that people take Saccharomyces boulardii. So there's one study that found taking Saccharomyces boulardii over the course of 14 to 28 days actually helped to eradicate the blasto. And so I always like to recommend that. This is a beneficial yeast. It helps to raise our secretory IgA levels, which help us overcome infections and help us prevent additional infections. But I don't like to just use that just because it's something that we really want to get rid of and we want to make sure we get rid of it the first time. So I'll oftentimes combine it with different types of herbs like oil of oregano, sometimes wormwood as long as the person is under supervision of a doctor and getting their liver function enzymes tested, and berberine. So those are some of the herbs that can be helpful, and generally you want to take them for 2 life cycles. So you want to make sure that you get the parasite in throughout all of the different stages. So certain stages that the parasite is in, it's not going to be accessible to herbs and medications. So it might have a little blastocystis is the second part of it is like a cyst. So it has like an encapsulation around it that prevents from herbs and things to getting to it in one of the stages. And the typical life cycle is about 30 days. So it's not, I like to think of it kind of like a little egg where you can't get past the shell and you wait for the egg to hatch, even though it's not technically that, but you want to give it at least 60 days or so. Medications. So medications that have been used for blasto, metronidazole or flagyl is the standard drug of choice. Unfortunately, many strains are resistant to it. So that means that the antibiotic just doesn't work against it. And so there are some newer types of medications. One of them is called Yarcinia that can be helpful for eradicating it. But of course, this is something that's going to be much more challenging on the gut. So that can cause yeast overgrowth and a lot of different side effects and issues. So I always encourage people to work with their practitioners and try to determine what the best route for them is.
Yeah, Yarcinia is really hard to get now. So that's exactly what we do. You know, we use we have a combination herb that has wormwood and golden seal and a lot of different herbs in it and black walnut. So I'm typically checking people's liver function prior to using that as our first line. If that doesn't work, then we'll move into, to flagyl, which is the metronidazole. And, when it comes to, I think it's great that you brought about that life cycle, which is another reason, to typically get a test through the functional medicine doctor, because some of them are DNA based. And so it doesn't really matter where it is in the life cycle. And that's one of the biggest reasons, at least with parasites, that these conventional stool tests miss a lot of parasites, is because it may not be in a particular life cycle, and then they're having to look in the microscope and find the actual parasite, and it has to be living, and it had to have survived, the stool getting shipped to wherever it had to get shipped, and there's all kinds of inherent problems in that. And yes, H Pylori can be really great for a lot of people. Just some people need to be careful. It's a yeast that fights yeast, but some people don't do well with it. So if you get on that, just, if you actually don't do well on it, check with your practitioner. That's one reason that it may not, be working for you.
Yeah, absolutely. And then I totally agree with you with the wormwood, just to be careful with making sure you're always working with a doctor on that, because you want to make sure your liver enzymes are checked.
Yes. And so what about H. pylori?
So H. pylori is another one of those infections, and this one has been connected to Hashimoto's in research. So they found that people with H. pylori, it's going to be more common in people with Hashimoto's and Graves' disease, and these people are typically going to have higher antibody titers against their thyroid glands when they have H. pylori. The cool thing is, once you eradicate the H. pylori, you start seeing a big reduction in a lot of symptoms, and a lot of times in thyroid antibodies. So I've had a few clients who have had, and readers who have submitted remission stories that once they found out they had H. pylori and they were able to eradicate their H. pylori, they saw a big reduction in symptoms, thyroid antibodies. Some of them were able to reduce their medications, perhaps because they were better absorbed, and others perhaps because the autoimmune process wasn't as aggressive anymore. So this is a very important, and I think a very much underappreciated infection in thyroid disease.
And do you want to tell people what H. pylori is for people who aren't familiar with that acronym?
So Helicobacter pylori is a bacteria that is typically associated with ulcers. So that's probably the most known activity of the bacteria. And typically, breath tests might be what's recommended for this. And you think of somebody who has an ulcer, and that's kind of the extreme situation when a person would get diagnosed with H. pylori. What I typically see in people with autoimmune disease is more of like a subclinical infection where they might have be positive on like a stool test for the H. pylori, but the breath test might still be negative. So they're going to have more of perhaps an immune reaction to the H. pylori, even though it's not like a full-blown infection. What's interesting, what it does is it also suppresses our stomach acid within the gut. And so a lot of times we know that when we have low stomach acid, we're going to develop food sensitivities, which are going to be very common in people with autoimmune thyroid disease. And then we're going to have a higher likelihood of catching parasites and all these other things. So really it's part of, it plays a really significant role in just weakening our overall gut response. And this is something that I would say is pretty significant in people with thyroid disease.
And so, and in terms of testing, there's, I don't know if you want to walk through the sort of difference between a breath test, a blood test, and a stool test.
I typically utilize the stool testing because it tends to, in my opinion, catch a little bit more of the subclinical infections, and that's going to be a stool antigen test. So sometimes a stool antigen test may be positive, even when the breath testing is negative. And whenever we see that, so something like a functional medicine test like the GI effects profile or the 401H test, that would be an indication to think about treating it. So it is something I recommend going through a functional medicine doctor. I have had some people do the other types of tests that have unfortunately come out negative.
Yeah, so just so people know, the blood test will always be positive if you've ever had H. pylori, because it's really looking more at a titer. So, again, if you've had it and you have antibodies to it, then it should always come up positive. And then so the breath test or the stool test would be more looking at an active infection. And, kind of what you were saying, Izabella, that the stool test can be a little more sensitive for those underlying not yet producing enough bacteria and gas to make the breath test be positive. Some of the testing now is also coming out with something called a virulence factor on them, and there's a lot of debate actually. My husband came up positive recently on a stool test, and so I'm part of this journal club that has literally, Jeff Bland, founder of functional medicine. I mean, it has every, all the faculty from IFM on it. And so I just kind of casually said, like, what are people doing naturally to treat H. pylori? And it started this massive debate of just back and forth emails about, should we really treat all H. pylori? Because there's some studies out there that, asymptomatic people with H. pylori, that it actually, with our entire immune system, it's a seesaw balance, right? And there are things there that actually give us tolerance and make our immune system work better. And there's a whole theory about certain, of us being too clean, and that some of these infections, there's, people now taking roundworms and helmets. I have a conversation with Dr. Sydney Baker on the summit here talking about actually giving back parasites to help people stimulate people's immune system. So there's actually a thought, like in the younger population, that you shouldn't treat H. pylori, that it's actually immune protective. And then later on in life, it becomes immune stimulatory and can lead to cancer. So this whole, besides the gut, this whole idea of these infections, it's really uncharted territory. And we're really, beginning to scratch the surface about what do we do about a lot of these infections. So there is a whole kind of debate about in the person who isn't symptomatic. Now, obviously, people following you likely have Hashimoto's and autoimmune issues, and in that case, we want to treat that. People seeing me also typically have either thyroid issues or other autoimmunity. So these are people whose immune systems have already been tipped, and we would want to treat those people. But I always like to use my husband as the guinea pig for what does a normal person look like, because he's healthy and has nothing, whereas everybody I see has got, is a train wreck. And so whenever I get labs, it's like, oh yeah, well that's normal, because it's always, looks terrible. So I don't know what a normal healthy person is supposed to look like. So I enlist my poor husband as the guinea pig.
Oh, that's a great point. And I know there was a little bit of controversy about treating H. pylori in somebody that's healthy, not symptomatic. And there was some data about when you eradicate H. pylori, people gain weight. And so for the average person, maybe that's not desirable. If you're fit and if you're feeling great and you come out positive with H. pylori, then perhaps that may not be an issue for you. On the other hand, if you have somebody with Hashimoto's with a lot of symptoms, migraines, joint pains, acid reflux, gut issues, thyroid antibodies, those would be all indications to me that that person is having an adverse reaction to the H. pylori.
Absolutely.
The other
Absolutely.
two is with family members. So you can actually, even if you have a healthy family member or even a pet, they can be a carrier and asymptomatic, but they may be reinfecting you. So even when you have, a husband like who's healthy, like my husband or your husband, it's also important to make sure that they are properly tested and their issues are addressed. So I know I had one story of somebody who couldn't figure out why they kept getting reinfected, and it was their spouse that ended up having an H. pylori infection. So in that case, I would recommend treating a healthy person.
Absolutely.
But other than that,
Yeah, my poor husband, he's like, and why am I doing this? I said, honey, because you're healthy. You can handle all these things. I have an immune system that's already turned on. I don't want any more things for my immune system to have to try to handle. So he's like, okay, so I had that, but I don't have any problem. Now, why do I have to treat it? I'm like, you're treating it so I don't get it. I'm like, huh?
Because you love me.
Yeah, exactly. Exactly. So, yes, and dogs as well. My poor husband and dog get subjected to all kinds of things that they're like, we're fine. We don't need anything. We don't care what you do for yourself, but don't do it to us. And it's like, well, what you have might affect me. So come on, we're doing this. Well, and what are some of your favorite go-to treatments for H. pylori?
DGL is a version of licorice that doesn't affect the raising the blood pressure, so I like to utilize that. And then mastic gum is also something that can be helpful. There's also some antibiotic protocols, but those are like pretty intense. Yeah. So there's like triple therapy that includes a proton pump inhibitor and some antibiotics, and then quadruple, and they include a lot of stuff. So that I typically will have a person will reserve that for like those really acute cases where they have ulcers, and that can certainly be helpful. But for the average person who maybe comes up positive on the stool antigen, doing like a protocol with something like mastic gum and DGL, L-glutamine, really supporting their gut, juicing cabbage, so drinking like 4 to 6 ounces of cabbage juice per day. Those are things that can be very helpful in kind of gently suppressing the H. pylori.
What about juicing cabbage and the cruciferous vegetables and thyroid?
This is such a big controversy in the thyroid world, and looking at all the data and all the research over the years, and I used to think that goitrogens were a big deal. And I think to a degree some of them may be, but the cruciferous vegetables, really looking at the data, like you'd have to eat a lot of them to suppress thyroid function. And the way that they work is by blocking iodine absorption into the thyroid gland. Now, that's going to be an issue if you have iodine deficiency, hypothyroidism, but we know that most people with Hashimoto's do not have a thyroid issue because they're iodine deficient. So in fact, people with Hashimoto's has been recognized as a condition of excess iodine. And I would say somewhere around 90% of people with Hashimoto's are not going to have an issue with not having enough iodine. Maybe somewhere around 5% of them might. And so those are going to be the people where the goitrogens may be an issue. But in that case, fermenting them or steaming them is going to be the right thing to do to break down some of that activity. And really, I think a really big reason that not a lot of people talk about why people might have problems with the crucifers is going to be because of something like SIBO and the Fodmaps in the crucifers. So they're going to be highly fermentable, and that can cause some issues from that perspective.
Yeah, I totally agree in terms of, in my book, I write about, the benefit far outweighs any risk of that. And if you're at all concerned, you can ferment them, you can steam them. I was asking just because if you are eating, cabbage juice to heal the gut, you're getting in a lot more cabbage than you would normally be eating raw, right? Or even cooking. Iodine, that is a very controversial issue, and it does seem that the iodine is related to whether those cruciferous vegetables. I mean, to me, I feel like this day and age, which is a whole nother conversation, and I do spend time talking about this in the book, is, the fluorides, the bromides, all the other halides displacing iodine. So in theory, we should not be an iodine deficient society, but I believe that we actually are because of all the other halides, displacing iodine from our body, and then, us not eating a lot. So I'd probably, I don't know where that stat comes from about that Hashimoto's is mostly too much iodine, because I think that there's a lot of data out there showing that all autoimmune and all thyroid disease is actually low iodine. But that's a big controversy, and I think that is where it gets into individualization with everybody. And certainly I'm not a believer of the 50 milligrams of iodine, but some iodine replacement, if not only just to protect ourselves in this world of all the other halides of the bromine, fluoride, chloride that are, just omnipresent in our environment.
Yeah, and absolutely. So we do know that the halides are a big issue, and then they can take up space in the thyroid where the iodine would normally be. And so generally I would say for a person with Hashimoto's, doing something like a multivitamin with iodine to 300 micrograms of iodine is going to be well tolerated. Where I get concerned about is when people recommend like the really high doses of iodine. And the theory behind that is that it's going to displace the other halogens and help to detoxify a person. And I think in theory that can work really, really well, except for when you have a person who's already really sick, and that can make them feel really, really horrible.
Absolutely.
Increase their destruction of thyroid cells. So I'm always, I kind of treat iodine like a drug, where I want to make sure a person's always working with a qualified healthcare practitioner. And, you start low and you go slow. So you figure out if the person needs it, and then you slowly introduce it, rather than giving somebody like a mega dose and having them potentially have an adverse reaction. So I'm totally on the same page with you.
Yeah, absolutely. I mean, I've had people come into my office swearing that, they were at a practitioner before me and were taking high dose iodine, and it is the thing that cured their Hashimoto's or their Graves or their thyroid problem. And I've had equal as many people coming in swearing it is the thing that caused their thyroid dysfunction. So you have to be very, very careful, people, if you're, if somebody's recommending that to you. And some people say it's only transient, but I have stories saying, again, I have both ends of the spectrum, and I think that's what happens. That I see typically all the people who've been harmed by something, which is why they're ending up in my office. It's not to say that there aren't equally as many people who got helped and they just never needed to come to me because they got help. So that's great, but you have to be very, very careful with those dosages. So yeah, we're right in sync with the kind of amounts and stuff.
And then with the kind of statistics, so I did a survey of about 2,000 people with Hashimoto's, kind of based on, and it mirrored very much what I saw with some of my clients, and maybe my audience may be biased, but for every one person that felt worse on a gluten-free diet, 88 people felt better. So a gluten-free diet is going to be something that I'm going to recommend to most people as a starting point, versus with iodine, for 30 people that felt better, 30 people felt worse. Yeah. So it's one of those things that is not going to be my first recommendation, but it's definitely a big part of the picture. And going back to some of those statistics, so the different countries have looked at potential triggers for autoimmune thyroid disease, and they've recognized selenium deficiency as a big trigger. And part of that has also been iodine excess. So we know that in societies that are already selenium deficient, when you give them iodine, that can sort of offset the balance. So then they're not properly detoxifying the iodine in their body, and then they're producing, you kind of think of like putting in all this input and having all this output without somebody taking care of the output, which the selenium would normally do, would help with the oxidative stress. So that's kind of where the statistics come from. And it's, like with nutrition, no nutrient lives by itself in a diet. So it's always a bigger part of the picture.
Absolutely. Well, let's talk about one that has been highly implicated in both Hashimoto's and Graves, which is Yarcinia or Yarcinia. You want to talk about that? I know you've written about that quite a bit.
Yeah, so there's a few different infections that are going to have, again, the proteins on them that are going to be similar to the proteins on the thyroid gland. And Yarcinia is going to be one of the ones that are that has been probably has the most research behind it. And it's something that we can get from undercooked pork usually, and it's going to be a gut infection. Some of the tests, like the GI effects test, may show that a person has Yarcinia when they grow it. There's also some blood tests that can be done for that. And generally, and this isn't every single person, because we know that autoimmunity is a combination of different factors. But in some cases, when people find and eradicate that infection, they start seeing an improvement in symptoms, as well as a reduction in antibodies to their thyroid. So this is something that can be treated either with like an antibiotic like doxycycline, or it can be treated with some herbal remedies. Some of the parasite blends do work for it, as well as oil of oregano, berberine, things of that nature can be helpful for overcoming that infection as well.
Yeah, so this is probably one of the ones that I think is most talked about in the literature as having, as you mentioned, this molecular mimicry with both Graves and Hashimoto's. And this is the one that I see clinically the least. It's just very difficult to pick up. There's some DNA-based stool tests out there, and still I have only seen this a handful of times. It's not to say that it isn't happening. It's just perhaps to say that the testing isn't very good yet for us to pick this up. I don't know if it's transient, maybe they're more antibodies or something, but this is one that I see ever so rarely, but it's sort of inversely proportional. It's the one that is, talked about everywhere regarding both, types of autoimmune thyroid disease.
Yeah, I second that. And then just to reframe for people listening at home, it may seem overwhelming to talk about all of these infections, but I don't know about you, but whenever I have a client and who has all these different infections, I actually get excited, because I know that when you identify an infection and you can treat it, the person will start feeling better.
Absolutely. I mean, I tell people, if you come to me and I find nothing wrong, that's when we need to worry. When we find things wrong, it's so easy. My job is easy because we just fix them. I mean, all of this stuff is fixable. So you have to worry when you get that stool test and there's nothing on it, or you're getting an ion panel and all your nutrients look great, and there you are sitting there feeling terrible, and you have autoimmune disease, and everything's coming back great on your test. So that's the point of functional medicine, is that you're looking at functional tests. Now, if you've gone to the doctor previously and all your tests were normal, that's not unheard of, because that's really looking at end-stage testing. You have to have something really wrong with your kidney or your liver to have those tests, really be out of whack. So when we're looking at functional tests, it's much more reasonable that there'd be something off, and you hope that there kind of is, because you're sitting there knowing that something's off. Usually when I'm doing my testing frequently, not frequently, but sometimes I have about a 28-page long ion panel that I do for people. And, often people will start crying midway through, as I'm telling them. And 90% of the time they're crying tears of joy that they knew something was really wrong with them. And here it is on paper, because it's like you might not have perhaps looked like somebody who had Hashimoto's, feeling really terrible. You can have Epstein-Barr. You might not look bad. You probably, my guess is, I'm making an assumption, you're a thin woman. You probably were not overweight when you had, Hashimoto's. With me, I remember when I was doing my book, or I was on Dr. Oz or somewhere, and somebody said, well, maybe we could have a picture of you for when you were sick with Graves' disease. I said, you don't want that picture. It was like
exactly the same, right?
No, I was like 15 pounds thinner. Like I had these like really fit arms. I mean, like I actually looked great, other than I had kind of like a little bit of bug eyes. Otherwise, I was like, I looked really great. And so I'm like, yeah, I don't think you want that picture. I mean, the bad part is I never looked bad. I mean, I was definitely thinner than I am. And I mean, I would say I was too thin, but some people might say I looked amazing, that I wasn't too thin. So the point of all of that is I see a lot of people like you and me, they don't necessarily look bad, but they feel really bad, and their family can't really understand because they look great. And so they can't understand that when they say it's difficult for me to walk around the block or even walk to the mailbox and back, they're thinking, how can that be? You look amazing. You've got to be making this up. This has got to be in your head. And then they get this blood test, these functional tests showing their mitochondria are completely shot. They have 3 infections in their gut, and then suddenly it's like, oh, thank God, I have something to go home and like show my husband that, really I am, here it is, here's the paperwork showing me I'm sick. So people, they start crying in relief, actually.
Mhm. Yeah, it's finally having a sense of validation when they see a doctor like yourself who's able to uncover some of the triggers and the root causes. And, if we talked about for example, one day I sprained my arm and it didn't really hurt, but I had like this cast on and everybody was noticing that. And I was like, nobody noticed when I had all this chronic pain with Hashimoto's, yet they noticed the cast, and it
Right.
wasn't that big of a deal. So it's just kind of funny how people see others with autoimmune disease and chronic illness, because it really is an invisible illness.
Right, right. Well, good. Let's talk about another one that I see all the time in my clinic: small bowel bacterial overgrowth or small intestinal bacterial overgrowth, SIBO.
Yeah, SIBO. So if you've been on the internet at all in the last few years, you're probably, and looking at health sites, you've probably seen SIBO. It's very much a trending topic, and it's something that is essentially an overgrowth of bacteria in a part of your gut where you're not necessarily supposed to have that much bacteria. And what happens at that point is your gut becomes more leaky. So we know that leaky gut or intestinal permeability is connected to autoimmune disease. For some people, SIBO or that overgrowth can actually induce leaky gut more so than eating gluten or an infection otherwise can. This is a study that was done within the last decade in people with hypothyroidism. Not sure if they were classified as Hashimoto's or not in this particular study, but about half of them actually had SIBO.
Yeah, I think they were Hashimoto's, if I remember.
Uh-huh. Yeah. I'm not sure what kind of, long story short, not sure what kind of labs they did, but
Right, right, right.
they said that people had about half of the people with hypothyroidism, which is most likely Hashimoto's, had SIBO. And so this is a very much big proponent of potentially causing being a part of the three-legged stool of autoimmune disease. There is the testing that's going to be most helpful and accessible to most people is going to be breath testing. So you can get a kit from your functional doctor. I know some places maybe sell them even online to people, like Direct Labs or something like that, where you take a special kind of drink and then you would exhale over a course of time into the bags, and then it would the test would determine whether or not you had bacteria based on the type of gases you produced. So this is something that you can also do it at like research facilities, and some gastroenterologists might have access to this, but it's pretty much pretty rare. So generally it's going to be a little bit easier to access. And what's interesting about this is there's a few different ways to treat this. One of the ways is going to be through herbs. So something like the berberine and oil of oregano can be used for a couple of months. Also doing something like garlic can be very helpful for a certain type of bacteria. And then there's also different antibiotics like rifaximin, neomycin that can be helpful for that. Sometimes some researchers have found that the elemental diet may work for people with SIBO. I personally have found with some of my clients with adrenal issues that can actually make them feel a little bit worse. So I wouldn't recommend, or sometimes even significantly worse. So I wouldn't necessarily recommend that a person take that on unless they have significant supervision on board. The other diet that can be helpful is going to be the low Fodmaps diet, where you exclude certain foods that are going to be more fermentable. And that helps to kind of starve out some of the bacteria and rebalance the bacterial population. And this is what's really important about this is that knowing that the different protocols may only take you down from like a severe to like a moderate overgrowth. So you still want to do some retesting to make sure that you took care of all of the overgrowth. And then you also want to make sure that things are moving along, you have enough stomach acid, and your gut is moving along properly, and you don't have something like H pylori, which would be leading to the overgrowth.
Yeah, absolutely. So, this and yeast or candida overgrowth are probably the two biggest ones that I see in my clinic. And And it is one like yeast that tends to come back. And so, all the things that you said for sure. And, diet, I find, is really the first line is, getting on a really low carb diet. I mean, other than your people with adrenal issues who may not be able to go super low carb, is getting as low carb as possible, because it's these carbs that feed these bacteria, and of course sugar and alcohol and things like that. And everybody's seen these commercials now for, I think, Xifaxan online with the irritable bowel without diarrhea, I think is the one that it's being marketed with. So that's made my life a lot easier, because this antibiotic prior to those commercials was $1,000 for people. And now with the commercial, it's a different dose, but it still works well. We can write it for that, and people are getting it covered. But up until few months ago, we were having to use a lot more herbs. So yes, the herbs work really great. In fact, for some people, the herbs work better than the prescription. Other people, the prescription works better. And then, as you've already mentioned, I mean, there are people who just need to constantly be on top of this. And I don't know, what came first, the chicken or the egg. They're just people sort of predisposed to this because of their inherent, gut bacteria. This is really a lifestyle situation, or this is, other infections going on top of it. And, this is in your small intestines, which is where this infection is where one is absorbing all their nutrients. So, right, as you were saying, this connection with Hashimoto's, or at least hypothyroidism, is that really because of this infection in the leaky gut? Or is this, not absorbing the nutrients? Or is it probably both of those things, right? It's opening up the gateway, no pun intended, of the gut and leaky gut. And then they're also not digesting and absorbing all of their nutrients properly, leading to these deficiencies that you had talked about previously, the iodine, the selenium, the vitamin D, the amino acids, all the things that we need to make our thyroid hormone. Which of the two is it? And it's probably both of those.
Mm-hmm. And I think another thing to note was, again, with the chicken or the egg, so hypothyroidism slows down our gut motility.
Absolutely.
And so we know when things are not moving along as quickly as they should be, that's when we have that overgrowth of bacteria. So potentially hypothyroidism can make it worse, and that can make hypothyroidism worse. So it's kind of a vicious cycle with that. I know some people have utilized something like low-dose naltrexone to successfully help with that, or even like the European formulation Iberogast to help things move, to help themselves with increasing their GI motility. Mm-hmm. So those are always, you've kind of have to play a bit of a detective to figure out what is happening with, why is the person having small intestinal bacterial overgrowth? Is there something else going on? And it's always, I think with autoimmunity, it's always something that you sort of keep an eye on to make sure that you're staying in balance, because like you said, if you have the predispositions, you may be at risk for having the SIBO grow back, and then you're going to be flaring up your symptoms again.
Absolutely, absolutely. One of the other things that we typically do is put people on I don't know if you do this as well, a soil-based probiotic, rather than being on sort of your typical lactobacillus and bifido, because it's often an overgrowth of the lactobacillus as well. So we often get people off of sort of their typical probiotic and put them on a soil-based probiotic.
Definitely. And then prebiotics as well can actually feed the SIBO. So a lot of times people, probiotics are generally good, but not if you have the specific condition. So it's really important to kind of tweak out some of those details. The devil's always in the details. I found Megaspore to be helpful for people with a particular soil-based probiotic to be helpful for people with Hashimoto's, even when they do have SIBO.
Yeah.
That's going to be something before using like a lactobacillus-based one.
Yes, absolutely. Well, this has been awesome. I really appreciate you kind of going through. Of course, there are other infections, but these are the ones that, Izabella and I see typically in, most of our clients. And so kind of the top ones to make sure that you're getting addressed, with your physician, and, just kind of recapping. Blastocysts better on a functional stool test. Yersinia also. SIBO, you can do a breath test, and I mean most I mean, I would say that in my experience, most GI doctors are kind of getting on board and understanding, about small bowel bacterial overgrowth. So I think that most of them are doing that now. H. pylori can be done through your regular doctor or a GI doctor or a functional medicine doctor. And then the Epstein-Barr can be done by your regular doctor. So out of those 5, 3 out of the 5, you can get through your regular doctor. Just people who are listening, I know it's always an issue is finding that practitioner in their area that can then help them. I think getting the labs can be very difficult for people at times, or finding a practitioner, affording a practitioner, things like that. So the more that you can actually get through your regular doctor, and then, getting on your blog, reading your book, reading my book, to get the information about kind of then what do you do once you have these things. Good news that 3 out of the 5 that we talked about, you can actually get in a conventional setting. Well, as we're wrapping up here, I like to always leave everybody with kind of 3 takeaway points from the talk, or 3 things that they can do today to start healing their thyroid. What would you like to leave us with?
One of the first things I'd like to leave people with is just to really be in charge of your own health. So learn as much as you can about your health, learn as much as you can about your thyroid, so that you can be your own health advocate, and then you can figure out how to work with the resources in your own community, whether that is a conventional medical doctor that listens to you, or finding a functionally trained practitioner. So really just take an active role. And I applaud you for being here and listening to our chat to be a part of that, and listening to the rest of the summit. The second thing is, if you haven't done it already, really tune into your nutrition. So a lot of times getting on the right type of nutrition can be very, very helpful for people. And part of that is going gluten-free and dairy-free. A lot of times that first step can be super helpful in getting you properly nourished and eliminating a lot of your symptoms. Some people can even go into remission with that way. And then, of course, the third one is making sure that you are looking at addressing any type of nutrient deficiencies that you may have, because that's going to be one of the fastest ways to start feeling better as well. So looking at vitamin D levels, looking at your B vitamins, as well as potentially looking at whether or not you have low iron stores, such as ferritin, is going to be a great starting point.
Great. Those are really great tips. We appreciate it. And Izabella, I know that you have your current book out. You have another book coming out in the early 2017. And then how can people find you in the interim?
People can go to my website, thyroidpharmacist.com, and I actually have a quick start guide, which talks a little bit more about the nutrient deficiencies and kind of the optimal thyroid diet that can get them started on their path to healing.
Awesome.